So first off, I am going to include a picture because our marketing team spent so much money on the Photoshop for it, so we're going to make sure that they get what they need. My role at Novant Health, which is a mid-size 16-hospital system in the southeast US, is Chief Data Officer. So not your typical Chief Data Officer because of the roles that I've had in the past, running Black Ops, running other application development and other things. I own all data. At rest, in motion, the definition, analytics, cognitive computing, how apps are designed off of it, all data. So with that said, basically that means I just do what my boss tells me to do. I have worked in every industry out there. Pretty much I move from disruption to disruption, pretty much because I don't know how to say no. All right, so Novant Health is a not-for-profit. It also is a very much a culture-based company, so very much a Southern wrapped within the culture. So we really serve the communities that we're in, which also means that we know the communities that we're in. So we try to relate as much as we can. However, that's become difficult as the communities change. You look at Charlotte, went from 200,000 people to 2.9 million within 20 years. So you look at the explosion and the boom, and now it's that personal one-on-one relationship isn't as possible as it used to be. All right, so by the numbers, you look at 16 hospitals, you look at 630 odd clinics, all of those doctors, that's spread out over a lot of area. That's a lot of people being served. You look at people from Charlotte, which is a banking culture, a lot of money, to places which don't have money, which are very Medicaid focused. So you have a wide range of people, a wide range of needs, and a lot of information. It's healthcare. Healthcare is one of those things where you look at the challenge. There's just data everywhere. The EHRs were designed to collect, so there was a lot of opportunity for improvement. All right, so as we get into AI, part of the expectation is that you get executives that listen to commercials, they have spokesmen who are always saying things like, AI is gonna change the world, it's gonna do this. So you get, and I have a son who does Legos all the time, you get this expectation of this awesome thing, finished product, we're all smiles, we're all excited about it. The reality is this is what it looks like coming out of the box, and you gotta figure out how to put it together. There's a tremendous amount of hard work, it's not appreciated, it's not understood, and it's actually hard to communicate unless you've done it before. There's a lot of math, there's a lot of computer science, and the most important thing, which is not actually understood most often, statistics. You need to understand statistics, because if you don't, and you make a mistake or you follow the noise, you will be in trouble. And in the healthcare sector, that may mean the wrong treatment for someone. So that's part of the reality. When you start to look at it when you're in other industries and you have a mistake in your code, it's a little bit different. Being on one of those calls where you make a mistake in healthcare is a different situation. So there are very different realities when you get to it. So the number of vendors, and I'm not knocking any vendor in here, has expanded tremendously. As you start to look at AI, machine learning, natural language processing, this is just at the beginning of 2019. This is just the landscape to choose from. And I interview and talk with 6 to 10 different vendors every single week, and they constantly come up. Part of the hard part of this is actually understanding who knows what they're doing and who's basically just selling snake oil. So every vendor comes back and they say, well, we have AI. We have AI. It's called math. So part of this is creating an environment where you can vet, where you can understand, and where you know who to pick from. All right, so as you start to go through the vendors and you start to pick this out, one of the things that becomes pretty apparent is there's a lot of trash. As you go through your data, you realize that there's a lot of garbage that you're getting in, you're running it through the models, and you're gonna get really bad decisions as you go forward. So the garbage in, garbage out. Now I've heard a lot about data democratization and AI democratization. In the wrong hands, data leads to bad decisions. So this is one of the things where democratization depends on how mature you are and how well people actually understand what they're doing. It's also one of those things that I hear it thrown around as a buzz term constantly. Oh, we need to democratize the data. That just basically means you just want to play. More times than not, Data that's presented ends up just being garbage. And a lot of the people that you see that are called data scientists, they actually don't have the skill set. Data scientist means they understand how things are going to be used. There's very much a business context to that position. This is one of the things that HR companies like to do as a data scientist. There's a difference between an engineer, a wrangler, and an actual scientist. And that skill set is something that has to be developed and has to be worked on. Other things that happen with this is bias. So as you look at all of the data that you have and you make decisions around it, are you making decisions off of historical data? And you're going to get something that's even worse. I'll take crime. So if I study historical crime and I'm basing where I'm going to put more cops based off of historical, I'm going to get them all sitting in the same place. I'm not predicting where crime's going to happen. I'm just essentially doubling down on what I already knew. So by leveraging those same models over and over, I'm just reinforcing things. Who's going to be my highest cost of care people for healthcare? Well, if I go to analyze all of the historical data, what about the people who didn't have access to healthcare? You're excluding them from actually having anything to do with the future system. So unless you understand the situation, the business context of it, you end up with junk. All right, as we get into the promise of AI and the promise of all of the things that are to come, and I think AI is assistive intelligence. It's a tool. It helps people make a decision. You start to get into the legal versus the ethical. Just because you have the technology doesn't mean you necessarily should use it. And I'll take facial recognition. So facial recognition has existed for a while, and I can use it to be able to track you as you go around anywhere that you have a camera. Now, I can use that in a retail store very easily. The minute you walk in, I can profile, I know who you are, I know your shopping habits, I know everything about you, and I can target you extremely effectively. But should I? So that starts to come down to the legal versus the ethics. On the flip side of this, as we talk privacy and we talk about my data and all of the things that goes with it, what if I could find cancer 5 years earlier? By knowing all of your habits, by knowing all of those things, I actually can find the stressors. I can find all of the little nooks and the crannies to actually help you long term. Would you buy in? So these are the questions that are going to have to be asked is, are you going to participate? And this comes down to, if I know what I'm getting into, I'm more likely to. So trust, transparency, part of building this out. All right, and this goes to one of the principles that we have. I know we've set up an AI Institute and Innovation Center. It's not a building. It's not anything more than helping people guide through all the decisions and take those innovation ideas and help them come to fruition. So all of those great vendor ideas, all these other things that come up, helping vet, helping work it through, helping fund, taking those ideas, and we've built out a cognitive computing department. First thing I went and did is actually got people who knew what they were doing and put them in there. And their job is to make sure that we take good ideas and actually bring them to fruition. Help people solve the problems that they're going to solve. Ton of good ideas. Ton of vendors out there. Are we using the right ones? Do we have the right data? Do we have the right things to make those decisions? So part of this is being a constant guide, helping people. Navigating through the world of AI. It's actually a very hard thing, but it really comes down to using a tool to make a decision, making it easier. And this is where we start to look at what's that hope of going forward. As we look into it, there are some really, really good things that are going on as we start to look at augmented intelligence. Some of the examples, being in healthcare, you get to work with a lot of really altruistic things, as opposed to, I would say, CRM. I'm not going to say CRM is bad, but using all of the information about you to sell you more stuff that you don't need is one way of working with data. Another is helping kids understand emotion. So as you look at, in this particular example, kids with autism, they don't understand what a smiling face is. It's a good thing. So being able to help those kids, train those kids, and help them to understand what emotion means, actually helping them see what other people are thinking and put up there. When they see someone's face and they're smiling, it actually puts on there, this is a good thing. It's a green light. So it helps that kid to understand what emotions mean. So this is really taking that world augmented analytics and putting it to context. So there's things like this. There's also the learning. So how many of you have ever played with a HoloLens? Microsoft's augmented reality, but it's one of the things you start to look at medical school and training. So Case Western Reserve is actually teaching, instead of dissecting cadavers, they're actually now playing with the HoloLens on and being able to dissect a virtual body and being able to see what's going on and have a team of people in different parts of the world work on the same object. The areas that this comes into use, now think about having to do surgery on someone and you're not an expert. You're in a remote area. Calling in someone who is an expert, being able to have them guide you through the surgery. The possibilities of being able to look at that type of intelligence, now put a machine on it, a machine that actually understands video. So now you're actually able to train it. Is this a good cut or a bad cut? Is this something that should be there? Is it something that shouldn't be there? And this is one that I worked on personally. So this is one of the companies that we helped fund and get off the ground. And this one is around strokes. So for those of you who know anything about strokes or any vascular issues within the brain, time is of the essence. So you go through every 15 minutes that someone doesn't get treatment to relieve a stroke, that's years of rehab. So you get into average of being able, from the time that you understand and see a stroke that's happened till intervention, national average is about 45 minutes. So our hospitals, we were down to 30. We put in this is live CT scanning. So it's actually taking high-res images, scanning what's happening, and finding things that are very hard to find. Now, it's not replacing the radiologists, it's not replacing the doctors, it's alerting them. Now they have the ability. If that specialist isn't there, it's routing it. So all of this is mobile. So if I don't have the right doctor there, it routes it into that particular physician, alerts him, high-res images using the cloud, gets it there, he has his entire decision tree, he can hit a button and call in other specialists to help him on the way there. So you start to look at that type of technology, it's gotten it down to 15 minutes response time. It's also caught 10 patients who weren't caught with the human eye. So you start to look at the power of image recognition. And image recognition is really where healthcare is starting to look, the ability to see cancer at minute levels, the ability to take a radiologist who has looked at 100 images that day to help them and notify them where they're missing things. So it's not just replacing, but it's helping assist that person make the decision. So you look at healthcare in general and other places, you look at those big ones around image recognition, you look at natural language processing, when you interact with a physician, how does that go? Are they typing the entire time, or are you having a conversation where they're actually understanding what's wrong? Keep in mind a physician only has 5 minutes to see you, understand what's going on, and make a decision. They're playing detective in 5 minutes. So that's the type of thing that you look at. Are they getting all the information that's been gathered in the past? Has it been dissected and giving them the questions to ask you? So this is part of leveraging the data that's collected in straight text, translating it, contextualizing it, and actually leveraging it to help make a decision. That's assistive intelligence. That's actually leveraging all of that information, leveraging the compute, leveraging the skill to actually help make those decisions. But this is also part of actually understanding what decision needs to be made and not just blindly following something. So that's it.
Fantastic stuff.